Ladies and gentlemen, this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week graduated magna cum laude from Marquette University School of Dentistry. She has completed several hours of continuing education and is currently pursuing her fellowship in the Academy of General Dentistry. Currently practicing from Broomfield, Colorado. Please welcome Dr. Elizabeth Minard DDS. How's it going, Dr. Minard?
It's going great. Thank you for taking the time to talk to me today. This is awesome.
That's so cool, man. I love it, man. I know how busy you are. Thank you for taking the time out. You know, I always start off talking a little bit about sports. You into sports at all? You watching any of the football going on last weekend, or you into that out there in Colorado at all?
I wish I could have a conversation with you about that, but I really can't. I'm a Packer fan, and once the Packers were out, I kind of stopped paying attention.
Nah, I got a lot of people like that. Once their teams are done, man, they're out of it. And it's just like, I've always kind of been that way too, but I've got quite a few doctors that are Packer fans, and they're real cheeseheads, man. You been you liking them since a kid, or tell me a little bit of why you like the Packers?
Oh, yeah. Well, I'm from Wisconsin and lived there up until August, so for my whole life, and have gone to many Packer games up in Lambeau and enjoy that.
Oh, that's so awesome.
Yeah.
Now doesn't all the team is owned by the people, right?
Yeah, fan owned.
Fan owned. That's amazing how they did that way back in the day, and it survived, and it's still, you know, just such a big thing in Wisconsin, and the people, by the people, for the people. It's too bad you guys haven't won in a while a little bit. It's but I remember you guys were dominant for years and years, and it's just like the last few, it's been off a little bit, but every team has their ups and downs. And like for us, man, Rams, they left us for like 20 some odd years, and they're back. And, you know, they kind of got in on a bad call. Everyone's saying about New Orleans game, but, you know, there's a lot more to it than that one play. And I don't know, just everything happens for a reason, and we're supposed to be there, and hopefully we can beat those Patriots, man. But we'll see. Tom Brady, he's the GOAT, man. And
the GOAT.
Yeah, the GOAT. Greatest of all time. I don't know about that. I mean, every new, you know, era in football or sports, you know, they always say, oh, this is the greatest of all time. This guy's, I think in your era, you know, it could be the 70s, and maybe there's the greatest of the 70s, greatest of the 80s, greatest of the 90s. I just don't think there's one greatest in any sport. And I just think, you know, hey, you can just, you can argue that all you want, but man, it's tough to say you're the GOAT. But hey, you know, he's definitely proved it with some big numbers. Okay, so hey, let's dental up now. So tell me, doctor, now, why did you get into dentistry, and at what point did you think, I want to be a dentist?
I was always interested in healthcare in some capacity, thinking about either medicine or pharmacy, nursing, dentistry. And when I was in college, I have an aunt who is a dentist. She really encouraged me to at least look into it. And she loved her career and loved the lifestyle, too, that she was able to live and not have to work, you know, 60 hours a week and have a family still. So after talking with her, I did a lot of shadowing and volunteering and involved with the Pre-Dental Society in college, and made the decision to go for it, and I'm so glad that I did, because it's been wonderful.
That's so awesome. Now, where'd you go to? Did you go to undergrad anywhere? Tell me a little bit about your college experience.
I went to University of Wisconsin-Madison for my undergrad, and then from there I went to Marquette, which is in Milwaukee, for dental school. Following school, I practiced for 4 years in Milwaukee. In August, so about 5 months ago, I moved to Denver, just wanting to pursue a more active lifestyle and make a big change.
That's unbelievable. That takes some real guts. I mean, tell me a little bit about your associateship those 4 years. Did you get in the trenches, learn a lot? Tell me what you liked about it, and some of the things you didn't like, if you could.
Well, I worked at a few different places, and for the majority of the time I spent in an office where I did all my own hygiene. We didn't have a hygienist. So that was hard, and it taught me a lot, and it gave me a greater appreciation for our hygienist. And it also allowed me to develop my leadership skills and hone my conversational skills and how to treat patients and things like that. But ultimately, I felt like it was holding me back. Like I wasn't doing as much clinical restorative dentistry as I would have liked. So made the decision to leave there. And from there, I worked actually as a locum tenens dentist, which is a temporary dentist. I did fill-ins for several months, which again taught me so much. I mean, being able to hop in at a clinic, having no experience there, and be able to work with different materials, different staff, and get along with everyone and provide good care to the patients. I mean, that taught me so much too. So grateful for both of those opportunities.
That's so cool. Now, how did you find Broomfield, Colorado, of all places? How did you go from there, Wisconsin, to Broomfield? How did you find it in a classified? Did you know somebody? Tell me how you got that as your place to go.
Broomfield is halfway between Denver and Boulder, a booming area. I don't live in Broomfield. I live in Denver. But so I had my sights set on Denver, and at least to live in. And I did a lot to advertise myself and look for jobs that weren't necessarily even posted. So there's a Facebook group that is in most cities called the Denver Dental Peeps, or in whatever city you're in, it would be called Milwaukee Dental Peeps, Chicago Dental Peeps.
Okay.
And I advertised myself there, posted something about myself, which is ultimately how I connected with the office I'm working at. But I also cold called a lot of offices, sent emails out to offices that I perceived as being top level offices in terms of high Google reviews, the procedures they were offering, and things like that.
Okay.
And then lastly, I also reached out to specialists in the area, an orthodontist, endodontist, to see if they knew of any general dentists that they've connected with that were hiring.
That's amazing. How were the people? A lot of people receptive to your calls and stuff, being like a cold call and stuff?
I got so many good, positive feedback. The people who I cold called, just that they respected that I acknowledged that their office looked like a great office. So they also respected the boldness of reaching out to them and connecting.
That's a good attitude, man. And you're so young. I mean, I don't even think you're 30, are you? I mean,
I am 30. I'm exactly 30.
I have boys. My boys are 32 and 34. Lordy. No. They can barely tie their shoes. No. Just kidding. But no, that's so awesome that you've been grinding at it almost 4 or 5 years already, and you're just so young at this, and you just got a really great attitude. You're using a great dental lab. I know that, but no.
Yeah, I've been so happy with Keating. It's been wonderful.
Oh, that's so cool, man. So tell me about your practice. What do you got working in there? How many ops you got? And, are you still doing some of the hygiene, or do you got a hygienist in there now? Tell me a little bit about your practice and the layout, if you could, and how it's operated, if you could, a little bit.
Our office is in an old Burger King.
Yeah.
So the drive-through is still there.
No
but my boss, Dave Fleischman, and his wife, Brooke Fleischman, are both dentists, and she designed the practice and just did the most beautiful job. Internal and external look stunning. We have 7 operatories, and actually are in the midst of planning an expansion too. With my arrival, it's just been super busy, and we're planning to grow. Brooke doesn't practice there anymore, so I took over her position.
Okay.
And I'm practicing with Dave, and with the 2 of us, we have 4 hygienists, and then 3 assistants and 2 front office.
I know it's called Fleischman Family Dental, right? So what about Dr. Fleischman? How is he with you? Is he helping you quite a bit and mentoring? And is he a good guy to work for? Tell me a little bit about him, if you could.
I feel so lucky, and I tell them this every day, and tell other people this too, that I was able to land this job at this office, because they're fantastic. Just good people, smart, smart dentists, good practitioners, and great to learn from, and feel like very fortunate and blessed to have moved all the way across country to find such a wonderful place to work.
Oh, man, it was meant to be. It sounds like that's so cool.
Yeah.
That's awesome.
That's what it feels like.
That's neat. What's it like when you go home, though, being by yourself? Or I'm not sure if you're by yourself, but is it was it pretty hard to, leave home like that and to come? What have you been there, like 5 months now? How long you been there now?
I've been here, around 5 months. No, it's been great. I mean, it's, changes like big changes like that can be tough, but I've just have loved meeting new people and being outside, hiking, skiing, and just taking advantage of the Colorado lifestyle.
You do that while you're young. When you get older, you want to sit around and watch TV and eat ding-dongs and stuff. At least that's what some of us like to do. Twinkies and ding-dongs, man. Breakfast.
Hey, that sounds good.
Yeah. Oh, man. So what about, what are some of the procedures you like doing, and what are some that you don't like doing right now in your young career?
I feel like my portion of the practice is largely restorative, and we restore a lot of implants. I do endo. I'm starting to get into the SPEAR curriculum, so I'm looking forward to doing more cosmetic and advanced restorative cases. So just trying to hone my skills and be the best that I can be, and just constantly be learning.
Any particular CE like in your young career? What do you like going to? Do you go to any of the bigger ones like the Yankee or the Chicago Midwinter, or do you keep them? Well, now you're Colorado. You're just going to keep it locally there, or are you doing some online? Tell me a little bit about your CE journey and what you're doing in that.
I've traveled for a lot of CE. Well, first, it's fun to be able to travel with friends from dental school to different places and learn together, but also have some fun while we're at it.
Absolutely.
So have planned trips with friends, but have focused a lot of my CE on endo. I went out to Santa Barbara to Steve Buchanan's course and went to a course in Vancouver.
Oh, you're kidding.
When I was living in Milwaukee, went to Chicago Midwinter, of course. Just this weekend was at the Rocky Mountain Dental Convention here in Denver. I'm heading out to SPEAR in 2 weeks. I'm taking the Art of Treatment Planning and Case Presentation.
Okay. How neat. SPEAR, man, you can't go wrong for sure. And do that Warren Dentition one. That's a real good one. But I think the one you're doing now would be a good intro level for sure. But that's so cool, man. I mean, you really do that. Do it at that young age. By the time you're 35, 40, man, you'll be set. I mean, you're starting ahead of the game. I mean, that's just really huge. A lot of newer dentists, they don't want to spend the money. They say they can't afford it, but you almost can't afford not to, I think. And the more education you can get, and the more hands-on like that, I just think it helps so much. And every patient that comes in, it's just like you just got the confidence and, to kind of present them what their options are and what you can do for them. And that's awesome, man. I love that. Spear or Coys, they're two of the best out there. Now, you can't go wrong with either of those programs. So hats off to you, man. That's awesome.
Thanks. Thank you.
I know it's kind of new at your practice now, but what's some of the marketing strategy they're doing to get patients to the practice? How they driving it? Social media? Are they doing some mailers? Working with the public sector? Tell me a little bit about that, if you could.
I think that we are super fortunate in that we don't do a ton. I think that we do obviously Google AdWords is a main thing, but I think that the largest thing that's driving patients to our practice is Google reviews.
Okay.
And we've really tried to put an emphasis on that in our practice, asking our patients for Google reviews, because ultimately, the best way for someone to find out about your practice is to hear it from other people. Absolutely. So when people can post something wonderful on Google and everyone can read it, that goes a long way, and it also drives SEO with the more Google reviews that you have. So that's something that we've been working really hard at in terms of growing our practice.
That's awesome.
And I also do I try to do a little bit of Instagram marketing myself, and that's just through a personal account. And I wouldn't say it contributes to a lot of our patients coming in, but we have gotten a handful since I started at the office in September. So that's something that we do, I guess, a little bit different than probably a lot of other offices.
Yeah, we'd love to show some of those links on our show page. Some of our, the links show some of the doctors out there, because a lot of doctors aren't really embracing social media, and it's still up in the air if it works or not for certain people. And we're even trying, and it's just we're trying to like do a needle in the haystack, go through all those millions of people to find a few of those dentists out there. And then dentists don't really want to get hounded from a lab, but yet it's a hard fine line. And the same thing with doctors looking for patients, but it does work for some practices. I've seen it, firsthand. And like you said, those Google reviews they're really, they do really help, because most people, when they're looking for something, they're going to Google it and just to see what pops up. And, they can see the good with the bad and the real from the not real on people and what they're saying usually. And, with people, I think it's just the best referral you can get is from a patient at your practice. And, they have programs now like Podium and a couple others that make it real easy to send it to your patients. Here's the link and you could just click on it. But, sometimes people don't have a Google account and they can't remember their password or something. But if you could make it easy for them to get on there and, just make it easy for them to go and just say what they feel, that's what, really helps a lot of these doctors get those reviews. And we need to do that more on our end for sure. But, no, that's really neat that, you're kind of doing that and, doing even on your own with your own Instagram. I mean, we did Instagram for a few years now, and we're getting up there and, with people, but, and they're just silly little pictures of teeth each month. And then we'll put our podcast on there, and, it could be more special. It's not real. Everything's not real pretty. It's teeth, but I find teeth pretty myself. But I don't know. It's just just trying to find a dentist here and there for us.
Get your name out there.
Absolutely. No, that's totally right. So, what do you think? There's any work ethic differences you seen between millennial doctors and some of the older dentists? Or
it's funny because I just wrote an article about generational differences.
Okay.
In dentistry for the AGD, the Academy of General Dentistry Impact magazine. Oh. And I shared it with my boss, and she was like, you don't fit the stereotypes of a millennial, certainly not lazy. I think that the perception that millennials are lazy is a little unfair. I think that certainly younger people have different perceptions on what they want work-life balance to be. And when our values are in the right place, we work super hard and want to find success and help people, and so I personally, I feel like I work so hard and commit so much to being the best dentist and leader that I can be that I don't feel that there's a difference. I'm sure that there's some young dentists that might fit that mold.
Yeah, and I just think the whole millennial thing, you're right with that. It's a few of them probably that are, on their devices too much and not really, the worker bees like a lot of us, baby boomers were growing up. You had to get it done, nothing's free. And I think a lot of the millennials, they see so much stuff on the interweb and they see all this wealth and stuff, and they think, they're like dreamers almost too much, but not all of them. There's still a ton of people that are they're going to try and work hard and they're going to put their time in, where there's nothing free in life and you just are always going to have to work for it. And just as long as you know that, and what you've done before age of 30 is quite remarkable, considering a lot of kids that, don't go to college and they just try to work the system like me. I didn't go to college, and, you kind of start at the bottom, sweeping the floors or whatever you got to do, but you got to work for it. And it's just hard, it's really hard. And it's no different than it was when we were growing up, but it's just, I just think they got pigeonholed a little bit with some of the millennials being, lazy. And that's just all that the news kind of saying. I don't think it's true in a lot of situations.
But I think there's a lot of factors to consider, like the student loan debt and burden that we are graduating with. Makes it really intimidating and hard. And it's not that we're being lazy. It's just that we're overwhelmed. I mean, there's some dentists graduating with $500,000 in student loans.
Oh, I know.
And so to take on buying a practice that's valued even more than that is like a tough decision to make.
Oh, it is. And it just goes back with us, trying to buy a home back then. It was like, it's so out of reach for us back in for me, it was the 80s, trying to buy my first home. And I remember that home, my first home, it was like $190,000, which was, under $100,000, not even a few years before that. It just went up so much. And now how homes have gone up so much everywhere else. And just the job, what you're getting paid for a medium income, I think it was as tough as it was then as it is now, but it seems like it's even more now. It's just the real estate's blown up so much. I don't think the employers are paying enough for these people to even qualify. In California, it's harder than heck, and it's just so many taxes, and it's just so hard for these young kids. But it was hard for us. I mean, I remember the biggest thing for us back then was to get the down payment for the house. I remember we were paying rents and apartments for like $600 a month for a 2-bedroom or something, and that was pretty big for us back then. And it's like now it's like I got an electrical bill that's that, and it's like, what the heck happened? I got a cable bill. It's like $500. Right. My wife's going, what the heck is this? I said, well, honey, there was a $100 fight, another MMA fight. And we watch a bunch of movies. Now they got the movies where you can watch it if it's in theaters. Like, oh, it's not $5.99. This is $22.95. I was like, heck yeah, let's get it. But that adds up, man. But we're just so blessed now. I don't know how I could handle me starting off right now trying to work and start my career. It's such a hard thing. And it still is to this day. I've been doing this since 84, and I just pinch myself and thank the Lord, man, that I got in it and I went through all the hard times, because it's just so hard, and you just got to stay confident and stay positive and just keep the faith, man, because this day and age, man, I couldn't imagine starting over right now. And even too, when you work for someone, I worked for someone for like 17 years, over 17 years, and I helped build that company, and it's like, dang, it's like, you kind of, not to put a damper on you or not, and you're going to do just fine, but I don't think you really get ahead until you own your own company. It's a big risk, but it's big rewards. And I just think till you really, but there's a ton of dudes and women and that in the industry of dentistry or any industry that they don't want that responsibility of everything. And, and just you live it 24/7 You own a company, and some people want to go to work, and that's what I thought I always wanted. And till you're let go, sometimes, you get let go, and I would have kept working, if I had my choice, but, I'm glad it worked out the way it did, because it put you in an uncomfortable position. And that's what they say. 90% of America was built by people that were let go from their companies, and they started their own companies. And it's just the way that works. And
I love that. That's awesome.
It's just something that, you're going to be working for, your doctors for a while, maybe forever, or who knows, or you might start your own. And it's just, you just gotta roll with it and stuff. I don't know, kind of rolling on here a little bit, but I'm just trying to get it across that, anything is possible, and just stay positive with it, work hard, and you'll be able to buy your home. You'll be able to, raise a family, and all things will work out. You just got to work hard and put your time and dues in. Nothing's free. And it's just nothing. If it's free, there's something behind it, because you got to put your time in, put your dues in, and good things will happen. But I just love it when I see younger people like you in this industry that really get on it and hit the road running hard at the young age. By the time you're 40, man, you're kind of really 40 to 50, you're kind of cruising, and 50 to 60, you could probably sell it or hang it up or do another field or whatever you want to do. And just dentistry is very rewarding, but it takes time, and it takes a lot of commitment, to make it happen. But dentists, man, it's a hard job, day in, day out. See these patients, and it's like, man, take them out of pain, or let's make them look better, or let's get them some function. But a lot of people have, different issues and stuff. You got to be part psychologist, part coach, part, awesome superstar dentist and MacGyver, and all of them all in one. But no, my hat's off to you for sure. What about you getting into the digital stuff? Do you think?
We are in the market. We're in the market for a scanner. I've used in my history at other offices. I've used the E4D plan scan, the Ceric Blue Cam, the Ceric OmniCam, and the iTero scanner.
All right.
So now we are at our office right now. Have been meeting with reps and are waiting to pull the trigger and decide what scanner we want to get.
Well,
that's the plan.
You better look at the 3-shape trios, baby, because that's one you didn't say, and that's the one that is really awesome. But you should put that into the group too if you're looking at them, because
it's definitely in the group. Although we are Invisalign providers, and that is a factor.
Yeah, I can't believe they're doing that. I thought they were going to get that all handled and stuff, but yeah. I think that'll be worked out here hopefully soon. That 3-shape will be able to, be doing it themselves with that. But, iTero's a great system too. And we use them all. So they all work. 3M's got a great system, TrueDef. And, it's just, it's really neat. Just the accuracy you're getting, scanning in the mouth, sending it off to me digitally, and, even doing model-less cases, and just so freaking accurate, man. I love it. We love it here for sure, man. So that's awesome to get on that. Yeah. So what about anything else going on this weekend? You're going to get over to, we got Voices of Dentistry out in Park, or where is that?
Are you going to that?
Yeah, I'm supposed to be going, but I got like this flu bug and my wife's sick, but my crew's going to go out there and we're going to try to get a little bit of content. Hopefully we can get some dentists to sign up to do our podcast, but I'm probably not going to be able to make it the way I'm feeling. And it's coming up like not tomorrow, I think the next day. I think it's Friday, Saturday.
Oh, okay.
But
can I ask you a question about scanners really quick?
Sure.
As long as I have you.
Yeah, absolutely.
You use the Medit scanner?
We get them sent to us, and I think we have to do it a little bit differently. But yeah, I mean, we're getting all scans from all of them for sure.
And what has your experience been with that scanner?
To tell you the truth, I don't think we don't get a lot of them. I mean, it's really mostly iTero, 3M, and 3-shape. We don't even get a whole lot of Cerics, because we have to transfer those off. Yeah. We're not a big Ceric guy. But it's something, the Medit, I know I know we got a couple of scanners in here from the lab, I think, because they can hold the models, the full arch models. And if I'm not mistaken, I think they're a South Korean company that makes those, right? If I recall.
I don't know.
Yeah, and their pricing is really good, and I know that, so that's a big thing. And I know just everyone kind of looks at the pricing, but it's just something I'll have to bring some of my managers in and just get a really good. I don't like to favor one over the other, but I like 3-shape because I've always been with them in my lab with the scanners that I use. And at the end of the day, if it's scanning in the mouth is pretty accurate, it's always going to be a little bit better because of, impression materials. They like to shrink and expand. I got dye and stone, and man, I tell you, this stuff, there's not a whole lot of variables to go wrong when you're getting a scan that is just so accurate like it is. And it makes the dentist practice actually a lot better with, if you take a shitty impression, it's going to be a shitty scan, and it's not going to let you go to the next, module on it. And so it makes you practice a little bit better dentistry, but I think it's just something, you'll be able to see things so much clearer and so much higher magnification. And I think after a few weeks, some guys it's a few days, some guys a few weeks, and some it's a few months. But they do get it, and once they do get it, it's just really an amazing thing. And I just think too, with a patient being able to tilt their head over and to see their model blown up, their mandible or their maxillary blown up, and you can rotate it and kind of show them what it's about and what we can put inside to this space, and it's pretty amazing, man. It's just
it is so cool. It is so exciting. All the technology advancements in dentistry is awesome.
Yeah. And you know what? You're going to see it all. Just don't jump on the bandwagon at all. And, for sure, what I'll have Bob Brandon reach out to you too and just give you a quick heads up, or Steve Tappy or even my CAD/CAM manager. They probably give you some good honest info on, pros and cons on each system, where I'm I kind of get to be little too much Trios guy, you know. But,
okay. Well, that would be great. Yeah. That would be wonderful. Thank you.
And thank God I'm the only sponsor on this Dental Up things. I could say whatever I want, man. I'm not, you know, I'm not paid by nobody. And so it's just something I just say the way I feel and what I see. So, but I'll let my guys reach out to you for sure and give you some good info on that.
Okay.
But hey, Doctor, man, thank you so much, Dr. Minard. God, what a great story. And I can't thank you enough for all the work, man, and everything. And gosh, that's awesome. But for sure, next year you got to get over to Voices of Dentistry. I got to get out there too. And, you know, we have dental seminars here and stuff coming up. We'll have to get you some info. Maybe we can fly you out for some CE out here too. And it's just really neat.
That would be awesome.
Man, I look forward to working with you next week. You got another 30 years in you at least, huh?
Yeah, let's go.
Let's do it. Let's get those roundies going. Come on.
Yeah,
we're gonna do upper lower grills all day, every day. You know, if you can do a 3-inch bridge, you can connect it around the horn.
That's awesome.
Well, man, thank you so much.
Well, it was great.
Great talking to you. God bless you. And hey, anything you need at all, please let us know. And thanks for coming on the Dental Up podcast.
Yes, thank you. You have an awesome day.
All right, man. Thank you so much. We'll talk to you real soon.
Okay, bye.
All right, bye-bye.
Thanks for joining us on the Dental Up podcast show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.